discussion session is focused on how the grand challenge was addressed by the NAPA Standing Panel on Fostering Social Equity. Now, given the objective, the overall grand challenge framework, to focus on what can be done in the first year of a presidential term beginning in 2021 to address the challenge issue, in this case, social equity, our panel emphasized frameworks and data collection that the administration could put into place quickly at the federal level to promote the equity in the distribution of public services and administrations of programs. One of the papers prepared by the panel addresses an across-agency framework that could be used to determine if proposed initiatives will be equitable in their impact or promote social equity through various means. The second related initiative took one program as an example of how to determine if existing programs are equitably distributed or if initiatives have equitable impact. So with me today are three of the paper authors and an additional member of the social equity panel who brings a local perspective to the issue. They are Gary Glickman, who is chair of the social equity panel. He has extensive experience around performance and evaluation issues, both within government and the private sector. Demetra Nightingale, an Institute Fellow at the Urban Institute and former Chief Evaluation Officer at the U.S. Department of Labor. Jade Berry James, Associate Professor of Public Administration at North Carolina State University. And Michael Jacobson, Deputy Director for Performance and Strategy in the King County, State of Washington, Office of Performance Strategy and Budget. So Gary, let's start with you. Could you summarize the movement toward efficiency and accountability in federal government and what the key federal legislation is around these issues?
Sure, thank you, Margaret. You know, let me talk about that in the context of social equity also. And there have been numerous laws that regard performance, regulatory provisions. For example, as we talk about in the paper, we have the Paperwork Reduction Act of 1980 that established the Office of Information and Regulatory Affairs within OMB, otherwise known as OIRA. As OIRA took on more responsibilities through further regulations and executive order, it gained more stature in terms of being able to shape the way agencies form their budgets and their policies. So for example, underneath the Paperwork Reduction Act, as Demetra, I'm sure will talk about, OIRA has the responsibility for reviewing all paperwork, all surveys that are going to be issued by federal agencies. And that's pretty much to ensure that there is no regulatory burden on the public. But they've also expanded that to ensure that those surveys will collect meaningful information and that that information is fair and unbiased. In 1993, under the Clinton administration, there was an executive order issued that also required agencies to consider whether existing and proposed regulations are necessary and required a cost-benefit analysis. And so what that did is it further bolstered the role of OIRA and required that agencies consider the costs and benefits of regulations as they propose them. So what that did was it had the effect of not only forcing agencies to start thinking about cost and benefit, but also codified a set of rules that OMB issued that would define what do we mean by costs and benefits, including soft costs and soft benefits. As time went on, including during the last administration and this, those rules have been further expanded to include equity issues. However, there's no set of rules that exactly looks at equity on its own. So while it's consideration, it's not a prime consideration. So what we would look at is could you develop a way of moving the culture of agencies by OMB issuing a set of guidelines that would address social equity? And so I would talk about that a little bit more in terms of the framework that NAPA is working on, but also that we would recommend that a new or a second administration would adapt as part of the OMB OIRA review for regulations and pending legislation. So what this framework would largely do would be to look at what is the impact of this proposed regulation on different categories of individuals, families, by group. And so what it would try to do is make agencies think about what is the impact, what is going to be the impact of this regulation on disadvantaged groups? And is it going to increase equity or decrease equity? So Margaret, I'll stop there and we can dive into that a little more during the questions.
Sounds good. Demetra, could you tell us where the federal government is in the process of implementing some of the most recent legislative requirements, and maybe talk a little bit about how easy it would be to build on the equity perspective in this framework?
Sure. One of the things that we talk about in our paper is that, in fact, no new laws or legislation would be needed to make some progress in promoting social equity. So there is existing legislation that, that is already authorized by Congress and could be leveraged to promote more of a focus on social equity in the US, and, as Gary began to discuss, to begin to track and assess and evaluate the progress that the nation is making toward reducing inequities. And Gary mentioned the Government Performance and Results Act, and the other major piece of legislation that's relevant right now is the Foundations for Evidence-Based Policymaking, or sometimes referred to just as the Evidence Act, which was enacted in 2018. And both of these really are requiring federal departments to first improve their access and quality of data for both performance measurement, management, and evaluation and analysis. And second, to improve the evaluation activities, the formal program evaluation functions. And so I'll just tell you a little bit about what that is. So the Evidence Act applies to all departments that are under the provisions of the Chief Financial Officer, which is all of the big departments, but that the act is really being promoted, and all departments are being encouraged to follow the new provisions of the act. So the act in implementation, they're just at the early stages of implementation, requires 4 things that I'll mention that could incorporate social equity. First is a data inventory. Every department is to do an inventory of the existing data sources, which includes big data surveys and data items that come from, say, the Census Bureau or health departments or the Bureau of Labor Statistics. And that inventory is to look at both the quality and the content of the surveys. The second, and accessibility for analysis and evaluation. The second is that departments are to develop an evaluation policy statement that lays out the principles that govern how research and evaluation is conducted in that department. And at the Labor Department, for example, and in almost every department, there are 5 provisions: rigor, transparency, independence, relevance to the department and to the programs, and the last one is ethics. And it's under the ethics parameter, the ethics provision, that could be expanded to include social equity. And there are important parameters that each department can set to send a message, a strong message, that social equity is a priority for research and evaluation. The third Evidence Act requirement is right now underway in all departments, which is doing an assessment of the evidence capacity of the department, which includes, do they have the right kinds of people to do evaluations of a high quality, and what kinds of evaluations and research, do they follow the parameters of the provisions of independence and ethics and relevance that I just mentioned. And then the fourth, which is more operational, is developing learning agendas and evaluation plans. And that includes incorporating input and engagement from stakeholders in the stakeholder community, including researchers, academics, but also the public and organizations that represent populations affected by programs. And it is under the learning agendas that some of the organizations, the associations, the stakeholder groups can have a big input into incorporating a social equity frame into the learning agendas. There are many more things that I can talk about, and I'll save that as we move forward, but I just wanted to mention that some departments already are trying to incorporate issues around inequality and inequity. The Department of Justice, for example, has a lot of databases that could be exploited. HHS, Health and Human Services, both around income, family support, and health education, Department of Education, and the Department of Labor, all have the ability to expand the databases that they currently have to include and sharper measures of social justice, economic well-being, which would allow then researchers to track and document the progress that the nation is making to reduce inequities over time. We can certainly get back to some of these issues.
Thank you very much, Demetra. Sometimes it's helpful to have a concrete example of how this might work in an individual agency around a specific program. So Jake, could you talk briefly about potential changes in food distribution that could be facilitated by focusing on the types of management and measurement and accountability that are underway, and talk about how this might foster equity?
Sure. Thank you so much, Margaret. I just want to say thanks for the opportunity to really discuss how we foster equity by improving child well-being and reducing food inequity. For children, especially during this time, during the COVID-19 pandemic, food insecurity is a major challenge in the United States. There have been some statistics reporting that as many as 3.9 million children are experiencing COVID-19 induced food shortages. One of our recommendations, as you know, included a review of policies, programs, and practices that really promote social equity in an evidence-based policy environment. Our working group made 5 really important recommendations for executive action that, taken in its totality, really support families in the United States who are in significant distress due to social and economic conditions. One of the recommendations in particular is that of the USDA federal policy, really a change that would align early care and education providers to increase access to fruits and vegetables provided to young children living in food insecure households, and embrace key programmatic areas, especially areas involving local procurement, gardening, and food and agriculture and nutrition education. The recommendation that I really want to underscore in particular is the one to establish a cross-agency priority goal that really improves or looks to improve child well-being. One of the things that we learned is that GAO had published in 2017 that across multiple dimensions of child well-being, in 3 critical areas, that being areas of a child's life: family, physical and social environment as one area, physical and mental health as another, as well as early early care and education showed a really interesting finding, and that is really that many federal agencies are working on collecting social and economic indicators that examine federal efforts to address child well-being across many policy areas. So we have agencies like the Center for Disease Control and Prevention, Economic Research Service, U.S. Department of Agriculture, the Census Bureau, the Department of Health and Human Services, the Department of Commerce, the Department of Housing and Urban Development, and the Office of Management and Budgeting. They are all working to improve child well-being in some area, but what we still continue to see is that well-being generally is worse for children who are minority, who are poor, and whose families are headed by single mothers. That may be a proxy for poverty in some instances. And so right now what we see is that at-risk children are living in the United States, and they are faring worse than others did. And there are some measurable gaps in child well-being that have really persisted over 10 years. And so it begs the question, what can we do about it? Well, we certainly have some ideas to support how to ensure that food insecure families are given high priority in areas that, especially where there are early child care sites and tribal community projects. So providing more SNAP benefits, in a way to help the most food insecure is another area. And I think that one of the biggest ideas really coming out of this working group project is that we support a cross-site evaluation system that relies on standardized data among all of those agencies involved. They help to it helps to assess activities and outputs, contributing to outcomes of improving child well-being and reducing food insecurity. And so, I know I'm running close to time. I'm definitely open to some questions. But I do want to say that we as collective group have recommended that resources are directed toward young children as a cost-effective way to improve life chances and as an effective strategy for promoting social equity. The other thing I would like to say is that it is absolutely true that food wealth is almost always certainly connected to good health. There's a lot of evidence for that. By focusing on the early years of a child's development, I think that we could do something about the cumulative impact of these measurable gaps that we see.
Well, thank you very much, Jade. It's we can see that there is at least one group that many people will agree should be a focus of social equity. Mm-hmm. Now, many federal programs are not administered by the federal government. Agencies are dependent on state and local governments and private nonprofit entities to carry out the goals of many of these social equity programs. And many jurisdictions have their own objectives as well. Michael, can you talk about how performance measurement and management works at the local level? How do you frame and set your goals? And particularly, what happens if you run into conflict between the goals that you have and those that the federal government passes down with their program?
Thank you, Margaret. I'm honored to participate in the panel today with the authors of the report. So I will try to address a little bit of the perspective of the local government view. I would just say, for some context, although performance management is considered a best management practice, there are very few common standards for states, counties, and cities. For example, we don't have a comparable piece of legislation to the Government Performance and Results Act that applies to us. That said, because there's no one codified way to conduct performance management, local governments have often been the incubator of innovation in terms of the form and structure of performance management practices. The widely adopted city stat model, originally created in Baltimore, is one example, and the non-manufacturing application of lean practices to government by Denver and King County would be another. Broadly speaking, local governments either use a strategic planning framework to identify goals, objectives, and measures, or they use leadership priorities that are defined by elected leaders. The more formal planning process has the benefit of explicit public engagement, formalizing the direction in a document. But it suffers from what we often call the on-the-shelf syndrome, where plans feel dated and organizations find it hard to pivot with changing conditions. Thus, you see the political leader view predominate in some jurisdictions. Local governments also use a wide variety of measurement frameworks, such as results-based accountability or logic models or cascading measures. There's two recent books by David Ammons and Barrett and Green that cover the diversity and evolution of these different performance management approaches that I'd recommend if you're further interested. At King County, we have used a mixed set of tools, although we have recently been focused on a lean approach, including cascaded planning, sometimes called Hoshin-Conry by lean practitioners, visual management, where we use measurement dashboards, until recently literally on the walls of our buildings, but now we're having to go virtual, and then regular performance results reviews with leadership focusing on key performance measures. We have a set of higher level priorities and operational performance measures, then annual plans of specific projects that are designed to move the needle. In order to highlight equity considerations, we strive to disaggregate data and portray data spatially to identify inequities in outcomes. Although King County is the home of Amazon and Boeing and many successful companies, and on average is doing very well by many indicators, the disparities and inequities in our community are unfortunately just like most urban communities in the US. We have an entire report called a Determinants of Equity report, where you can look at the disparities that exist within our relatively wealthy, well-educated community. So when you disaggregate, you're able to see the differences between different populations or in different regions, even within the county. In addition to these more, what I would call generic approaches to data disaggregation, I think it's also essential to have explicit equity priorities, objectives, and measures. In other words, don't leave that to chance. At King County, for example, we've created an equity and social justice strategic plan specifically to articulate our goals and objectives in the arena of equity. And then one of the key principles we use throughout the plan is the concept of targeted universalism, where you basically are applying universal principles to targeted populations and who are most in need. We have also applied kind of similar approaches with equity objectives and use the same tools as we have in our general performance management system to drive results internally and externally. For example, we've identified having development plans in place to promote career progression for the staff at the lowest pay scales. We have that set as an objective with standard measures, and those results are regularly reviewed by HR and other leadership. I believe data disaggregation helps to show that all measures can be, quote, equity measures, and equity-specific objectives and targets are essential elements to make progress. We collectively, not just at King County, but I think nationally, are still not yet in the habit of asking the standard equity questions. Are there differences in results between different populations or communities? Calling those out, identifying targets, using performance management skills and tools, I think helps advance those issues. And then in terms of alignment of federal and local goals, I just make a brief comment. We certainly benefit from federal resources for our transit, public health, and human services functions. And I can say we're currently working to advance our strong equity agenda, even in the current political landscape. Thank you.
Thank you, Michael. Why don't we follow up on this data question? And this is either Demetra or Michael. Maybe we'll swing back to Demetra. How can we address challenges in getting estimates by race, whether it's programs that are federal programs that, you know, where it's sort of centrally held, or whether they're programs that maybe the federal government sets the framework for, but is dependent upon local governments to get the data. Demetra, you want to go first? You're mute, Demetra.
One of the recommendations that we present is to require every department to do a social equity data and statistical inventory to get at the part of the question that Margaret asked, which is to identify the sources of data that would be able to disaggregate the way that Jade and Michael were both talking about, to be able to disaggregate by subgroups, by race, by age, by geographic area. And as all of us know, there's lots of federal data. The problem is that we can't always disaggregate enough to identify the inequities. But one obvious statistical way to improve it would be to expand the samples, because often the reason we can't disaggregate is that the sample sizes are too small to do that. So one strategy would be to expand the survey sample sizes The second would be to add additional or improve the demographic categorization of questions that are in the surveys. And the third strategy that could be very helpful would be to capitalize on the kinds of things that Michael was talking about in King County by the access to both federal, state, and local data for research and analysis purposes, as long as we're maintaining the strict privacy and confidentiality provisions that are necessary to do that. So I think we can do a lot at the federal level, but we need the connection between federal data sources and state and local in order to really understand the extent of the disparities and more importantly, to track over time the progress toward improving equity.
Thank you. Now, not every program has explicit equity goals. Jade, can you or Michael perhaps give examples of explicit equity goals? And if so, how have those goals been helpful in achieving results?
Sure. Did you want me to go first, Margaret?
Sure.
Okay, great. One of the things that we talked about is the equity concern in the paper on child well-being indicators. The concern is that there should be this sort of general viewpoint, the same kinds of data that are collected across all different agencies involved in sort of measuring child well-being. So there does seem to be a commonality or an opportunity to conduct a cross-site evaluation of where we are with respect to child well-being using an equity lens, right? So some of those indicators might be food insecurity. Some measure with the Department of Agricultural Economic Research Service looks at that measure and also looks at that measure by race, ethnicity, for example, or by income or by female-headed households as key dimensions there. And then for obesity, we know that while food is connected to good health, decisions that families have to make, especially in times of, in current times, suggest that maybe there's not enough money to go around to get the best food. And so you have the Department of Health and Human Services, as well as other agencies that are looking at these indicators for obesity. And so there's some definite connections or opportunity to evaluate the condition in which obesity exists among youth and the way in which these sort of determinants of health are looked at or examined, especially in county profiles, right? And so we know that obesity is really an early indicator for long-term health outcomes like diabetes, stroke, heart disease, arthritis, and certain cancers. And so we also know that some children are more likely to live or report higher rates of obesity. And we know that those differential outcomes are based on race and also income for Black, Hispanic, or poor children. But then there are some other indicators like cost and quality of childcare. And so here you have the Department of Health and Human Services working alongside other groups, right, who are looking at the cost of childcare, the proportion of money spent in families for childcare. And so that particular report, those kind of markers are important markers. And then the last piece is on preschool enrollment. We certainly have the Department of Commerce, as well as the Census Bureau and the Department of Education Early Childhood Program that participate in surveys that also look at participation by race and also income. And so I think that all of those indicators together across a racial equity frame, right, common indicators can easily be set up as long as we prioritize in that kind of way. I've worked in other studies where we use the cross-site evaluation system to identify at least 10 key indicators, and everyone, whether it be at the local level, the state level, or at the federal level, use those kinds of metrics or measures to report back to Congress the impact that we've made with the funding or the opportunity to serve citizens. And so I think that that's a strategy which is super exciting given this time and given the challenges in front of us.
Okay, thank you.
I think, unfortunately, I would say that we're in a target-rich environment. And what I mean by that is almost anywhere you look, we see inequities. So whether it's a criminal legal system, who's having a disproportionate contact with police force, as well as each individual step within the prosecutorial and sentencing process, racial inequity gets worse at each step. And so, and this doesn't, you don't have to compare just blacks to whites. You can just compare within a racial category proportionality within the population, right? So it's not, you're not having to necessarily take on a dominant white metric as your baseline, which some people have been recently criticizing as the inappropriate standard. But you could just say, given our population in our community, how many people are, how many kids are in the juvenile detention? How many adults are in jails and things like that? One of our department directors recently commented that we've largely solved homelessness for white people. And what he meant was that if you're a person of color, that the systems are not working for you. If you're white, generally, we have a way to get you in and move you up through the maturity of housing systems. But if you're a person of color, we have not figured that out, or that you're experiencing various traumas along the way, or you're not trusting of the system. And so you'd rather stay outside than be part of one of the programs that we offer. So that's a really telling indictment, really, of the kind of disproportionate racial disproportionality that we're seeing. I think anywhere you look, you could start, as you start looking at these disaggregated data, you realize though that it's in almost any circumstance, whether it's education, child welfare, et cetera. That's the unfortunate perception that I have. So,
Michael, thank you for making that point. It is true that race matters and race still matters. And so going forward, what also matters is the way in which we sort of look at the data that's available to us and do something about that particular aspect of the problem. So I totally agree with you. In fact, race still does matter.
And Margaret, if I might chime in with another concept, one of the things that is a trick or is a challenge for us as practitioners is we want perfect data, but perfect data are very expensive and hard to collect, and people don't want to check off 100 demographic boxes when they finish a survey. So even the term Black African American includes people who are immigrants from Africa. Asian Pacific Islanders includes people that have been here multiple generations, well established, comparable to whites in income and educational attainment, as well as immigrants and people that don't speak English. So these large demographic groups are often hiding their own disparities even within those groups. And we're seeing that with COVID, that certain groups in King County are much more severely impacted within Asian Pacific Islander meta group. There's specific populations, specific folks in specific cultures that are much more negatively impacted than other groups even within that category.
That's a very good, important point. Let's swing back to Demetra, who's, been certainly before she left government and following it from outside now. Tell us a little bit about how this data collection issue it affects how the feds move ahead with some of these measures of performance management and measurement.
Right. I mean, one of the difficulties is that you have, in a federal department, you've got program data, and then you have national survey data. And in both cases, sometimes it is of interest to disaggregate by race, but also by gender and age. And the more you disaggregate, the smaller those cell size get, and the more difficult it becomes to develop an indicator for the disaggregated categories. And so a challenge is to improve the data. The data certainly exist, but we may need to expand it and expand it over time. One of the recommendations that we include in our paper is to establish, and I think this has already been mentioned a couple of times that for different purposes, but we're saying establish maybe a cross-agency priority goal on social equity. Every department could do more to reduce inequities, either, as Michael said, they're doing in King County, looking at human resources. So even if the program itself doesn't have an equity objective or an equity mission, the organization, the agency can establish social equity goals. So if there were a cross-agency priority on social equity, it would encourage and nudge the federal departments to think about social equity within their own organizational environment, whether it's by program or for the department as a whole or an agency, whether it's for their own human resources activities or improving their data systems so that indicators could be developed.
Gary, let's go back to a couple of things that you started out with, which was the framework of program evaluation and performance management. How can some of these formal program evaluations be aligned with the sort of equity ones be aligned with the performance and GIPRA requirements?
I think, I would start by referencing what Demetrius just talked about, which is a cross-agency goal and trying to nudge the agencies. Even agencies that don't have a specific equity goal do have equity issues that they face. And as Michael discussed, there's no real consistency across government, not only across federal government, but across state and local governments on how equity issues are approached. So what we are proposing is development of a framework that would start at the federal level by looking at different program areas, such as social justice, criminal justice, such as food security, such as housing, tax policy. And if you look at those different issue areas, all of them have implications for equity issues. And those equity issues cross race, they cross ethnicity, they cross urban versus rural, income levels, and looking at what are the questions that need to be asked. Now, some of those cells, when you think about that, such as the intersection between race and criminal justice, have a lot of data. As Mitra said, some of those cells get very data rich, others are fairly vacant. And so the first step would be to identify what are those cells that are vacant and how do we enrich those data cells to enable agencies to be able to better assess what the potential impact or what the probable impact of a particular policy or regulation is on equity issues. If you could create this framework, then that framework can become a couple of things. First of all, it can help OMB do its evaluation, but more importantly, it gives agencies a reference point and starts to provide some consistency across agencies, which starts, as Demetra said, to nudge the agencies toward a more common view of equity. They can then start using that in the grant process, and as such, push it down to state and local governments. State and local governments, where Michael has done a great job of creating their own equity indicators in Seattle, many jurisdictions lack that same dedication. This would give them a tool that would not only increase their capacity to learn about equity issues, but would also decrease the the amount of money that they would need to spend in developing their own indicators. So you could develop these, you could accomplish a lot of different things at the same time that would increase performance metrics and making equity performance one of the key equity indicators that we'd be interested in.
Thank you, Gary. Michael, let's come back to you. You're kind of, let's say the equity demands come down from above and they land in your lap. So how do you deal, for example, there may be some conflicting goals here where some programs require equity or targeting and others seem to be in conflict. How do you both manage that and also deal with maybe different ways of aligning your data?
You're not going to let me escape that one, are you?
No.
It's a really good and hard question to answer. I think, you know, we're always having to meet federal requirements. It's just, you know, there's no free lunch, right? So when we get money, there's requirements that come with that. Sometimes those requirements aid us, right? You know, that there's service standards or expectations that get passed on with transit money. That's good. That allows us to survey our customers in a way that we might not be able to on our own. There's other times where, you know, equity considerations are not included or are precluded. You know, we, even within the state of Washington, we actually have statewide legislation that, you know, prohibit targets around hiring and other race-based standards. So even in our own internal HR things, we are very careful to we don't use that term, we don't use the word target. And so we are having to navigate the kind of, you know, legal compliance with sort of, with leadership intention and goals. But it's, you know, when they're in direct opposition, we have in the past, sometimes, for example, that there was a criminal justice grant that was offered to us, and it required us to do some things that were against our local political interests, and so we declined that grant. It's hard to turn down money, but there's some places where you know, the principle just is bigger than the dollar figure, and that's a hard position because money gets programs and helps people. So, but in many cases, there's enough alignment that we can manage. We're currently struggling with some of the current expectations, executive orders coming out of Washington around training around anti-racism, for example. So that is, we're not supportive of that, and we're going to be having to manage that very carefully.
If I could just,
go ahead, Demetra.
I just wanted to add one point there. You know, when I was at the Labor Department, people would ask me what I did, what was my job. And I often said that over 50% of my time, every day, every week, every month, was spent on data. Getting quality data, dealing with lawyers about restricted data, trying to share data, the privacy issues, the inconsistent definitions across programs for the same issue, whether it's something basic like race, even gender, differences in the reporting, which makes it very difficult to combine data across programs. And for some equity issues, it requires getting data from about health, about education, about income, about employment that may come from different sources of data. And at the programmatic level, that data sharing becomes an even bigger issue. So the kinds of things that Michael and Jade were talking about in terms of looking at a comprehensive approach around social equity are sometimes hindered because of different definitions in different programs. So a big challenge, I think, is dealing with a way to align the kinds of definitions and measures that are in there. And I think that can happen over time with a high priority on social equity as a cross-agency priority or a White House initiative. It will gradually move the system toward having some standardized definitions and measures.
Well, is there a role for OMB in this coordination? Either you or Gary or both of you might want to comment on that.
Well, I could start. I think there's definitely a role for OMB. OMB is the one central point that all regulations come to for review. It also issues policy guidance during the budgeting process as well as during the year, and therefore has a lot of sway in terms of how agencies at the executive level start thinking about these issues. And so even establishing the cross-agency goals, performance goals, should come from OMB, because that would allow the agencies to start focusing on those issues, and during their the budget hearings that OMB goes through, discuss how they're addressing them. And so it would provide some consistency that's not there now.
I would just add to that certainly OMB plays an important role. And to me, the most important role that OMB can and does often play is around prioritizing issues and facilitating the functions of agencies. What doesn't work is it doesn't work as well for the departments to have checklists and templates that have to be filled out and completed for OMB. But what does work is the coordination that's required for cross-agency priorities, for prioritizing an emphasis on social equity, for example, for facilitating agencies to work in their own organizational context that makes sense for them, a way to meet some of those emerging priorities. So it's really a partnership between OMB and the agencies, not necessarily a directive role.
Okay. Gary, NAPA is looking at a framework, or thinking about pushing a framework beyond this grand challenge into a broader set of looking at social equity. Could you give us a quick summary of that?
Sure, thank you. I started to do that during my last comment. What the framework is a way of looking at what are the questions that an agency would need to ask when it's considering a pending regulation policy in terms of a specific category of individuals or families across different dimensions. So the framework would actually have 3 dimensions. The first dimension, if you can envision a 3-dimensional matrix, across the top are the different program areas such as criminal justice, food security, tax, etc. Going down the side, you would envision different groups that could be affected based upon income level, based upon race, based upon urban versus rural, etc. And each one of those blocks would ask questions, give illustrative questions and data sources. That's the 3rd dimension of that matrix. So for example, within housing, there's been a tremendous amount of research already done on equity issues. And so those questions that an agency would have to ask, or if it went down to the state level or local level, the types of questions that would need to be answered in order to ensure equitable policies would be within that framework. And then further, as you delve down into those cells, it would provide resources and data sources that would allow the individual agencies, as the Metro said, it's always got to be customized to that individual agency or question, to access existing resources. So it'll be a much more efficient way of getting to those questions and review processes.
Thank you. I think we're nearing the limit of our session. So I'm going to ask each of you to do a lightning round. We'll go around and we'll leave Gary for last, since he made the last comment, and just give a very quick statement about the social equity and performance issues that we haven't covered, something you think is very essential for people to know at this point. Let me see. I'm looking at my screen. I'm going to start with Demetra.
Well, one of our recommendations that we haven't really talked about, which I think is very important given the Evidence Act implementation, is to require every department to do a social equity evidence review, to think hard and to put down on paper what is known, what does the research say about equity and inequity, what are unanswered research questions, and what future research and evaluation might help to fill knowledge gaps.
Okay, thank you. Michael?
Yeah, thank you. So I think COVID, has exposed many inequities that people have been living with for many years, but it's made them worse and it's put them into sharp relief. So I think there's an opportunity to kind of flip that around and think about the silver lining aspect of this. What have we seen that we didn't see otherwise? The disability community has been left behind, even despite legislation around ADA, that many of the access issues that they have raised, for example, have not been adequately addressed. And so just use this time to reflect on what has been, quote, exposed and made more visible, and try to then work towards defining goals and measures and be explicit in trying to move those forward.
Thank you. Jade?
I would say that, most of the focus is for us to consider a coordinated effort. And in considering the coordinated effort, like other efforts that I've been involved in, we've used data, reliable and valid data, to help inform Congress about the impact of funding on a particular issue. And so when we have these national surveys that don't include true profiles of racial ethnic groups, I would argue that we need a targeted capacity approach, right? We're going to look at or refocus our efforts to ensure that information that we use to measure the impact, understand the challenge, look at disproportionate activities. I think that it really needs to beg the question, is the data that we have in front of us valid if it doesn't include specific groups of people, if it doesn't include information that we need to know in order to gauge how well we're doing on any particular issue? And so we might often think about just using a new approach to engage certain communities. There's a lot of different ways in which we could do that. Of course, I have lots of suggestions, right? But I really do believe that establishing a cross-site evaluation system, one that relies on standardized data as an assessment of activities and outputs, really helps contribute to our outcomes, our equitable outcomes. The fact that government works, yes, but does it work for all is the big question of the day.
Thank you. Gary, do you, as the chair of the social equity panel, do you have any last words for us?
Thank you, of course. I would summarize it by saying that in the wake of the pandemic and the social unrest, we have a tremendous opportunity to rebuild the economy, to rebuild our program structures, and to make investments in the future. And I think the things we've been talking about, the data, the analysis framework, all of that creates the opportunity for policymakers to better understand what the impacts will be. So we're not always going to come up with the right answer, but we can at least arm people with the data and the analysis they need to be able to start making the right decisions. Whether those right decisions are made or not is going to be up to them and ultimately the people that they serve. But that data is critical because in the absence of it, we're guessing. And we're guessing based upon ideological or other data that aren't necessarily representing reality. So I think what we're talking about is increasing the realm of data and the use of data to better understand the impacts so that we can at least have that as part of the arsenal in making the decision. Similar to what we've done with cost benefit, and other types of analysis.
Thank you. That's a very good way of summarizing what we might be adding to the discussion of good government and equity for all. So I thank you all for participating in today's discussion and look forward over the coming year to how these things unfold.